We initially opened to accrual at 3 sites initially in 2019 and 2020. And were able to enroll to that first dose level, and then opened up dose level 2 in 2021. And then most recently, we were able to move on to dose level 3 just this year. Unfortunately, at dose levels 1 and 2, we have not yet seen tumor responses. And so we wanted to take a preliminary look at the pharmacokinetic data, or those drug concentrations from those dose levels, really before we proceeded to dose level 3. And what we found is that the patient's losartan concentrations were lower than what were expected, at least based on comparing the doses we were using and what were used in the dogs. And certainly the concentrations were lower than what was seen in the dogs who achieved responses. And so losartan is actually typically dosed just once a day in humans. So that had been our initial dosing plan for dose levels 1 and 2. However, given the preliminary pharmacokinetic findings, together with the fact that patients really were not experiencing any concerning side effects in the early dose levels, it's been very well tolerated. We opted to amend the protocol to increase the losartan dose further for dose level 3 than what we'd originally written, but split the dose by giving it twice daily, which is actually also how dogs are given losartan. And so we're hoping that it more closely mirrors the dosing for the dogs. And again, we're trying to push that dose in a safe way, but as far as we can, because patients have thus far tolerated it so well, to really see if we can get those responses that the dogs got. So far, we have enrolled just 1 patient at dose level 3, and we don't have any really preliminary PK data back or anything yet. So it's really too early to say anything definitively about these modifications since it just reopened. But we will plan to continue enrolling to dose level 3, and then we would do another kind of interim analysis before we decide about proceeding to that dose level 4, which, if you remember, doesn't increase the losartan further, but would increase the Sutent dose slightly.